hey, I don't know what your situation is at the moment, but a friend of mine recently been trying to get an appointment to see a doctor for their children just before Christmas, and it has been just about impossible. It's a full-time job trying to get a doctor's appointment at the moment. And hey, there's a lot of pressure on the medical sector at the moment. And hey, there's only so many hours between now and Christmas. Not meaning to spook you, but it's true. If only, I don't know, there was some type of AI tool which freed up the doctor's time so that they could spend more time with patients, and it would be perhaps easier to get an appointment. I'm not sure if that's directly connected, but that's my link. Joining me on the program now from the Maxim Institute, Debora Spiekermann. Debora, kia ora, thanks for your time today.
Good morning, Andrew.
We've talked AI beforehand, and there's some concerns there. We've seen the movies, but actually an AI assistant for our GPs to help them focus on their bedside manner, being present with their patient, not having their backs turned so that they're typing notes at the same time and occasionally looking over their shoulder. Surely this is a good thing, but I know some people also have some concerns.
Yeah, no, definitely. I think we can really clearly see how this could be a great opportunity to save time on the doctor's side, especially for them to be present during the consultation, actually look us in the eye, actually, touch our bodies, make an examination, check us out.
Yep.
And while an AI scribe could be listening to this whole conversation and noting down every word, it can provide a summary for the doctor. So there's a great opportunity of saving time there, and maybe some stress and some workload for the doctor. Yeah, I think one thing is we need to be comfortable with the fact that our data at the moment is actually the Heidi data, which is the AI scribe, which is right now being trialed in New Zealand. The data will not be stored in New Zealand. So the company Heidi Health is using a third-party server in Sydney to store the conversations. And so that's a bit of a question mark there still. I mean, I think the team is working on a way to store the data locally in New Zealand, but that's something to just have in mind when we talk about it.
Can I just jump in here and say that Heidi is a good strategic choice? If you're going to name a medical AI anything, I mean, Heidi, classic children's literature. Heidi was a lovely person. I don't think there's any Heidis in popular culture that's nasty or suspicious in any way. That's good marketing right there.
I think so. I definitely think the name was chosen on purpose to just sound more loving and make patients and doctors in general more comfortable with the omnipresence of that tool, which in itself I think is fine and makes sense. Another thing to be aware of, or a good question I think that has been asked by experts in New Zealand, is whether young doctors or training doctors or medical students should be using this tool.
Okay.
It's kind of like when you're in school and you're learning calculus or you're training to become a pilot, you first need to actually be able to fly a plane.
Yes.
Before you can turn on the autopilot. Same with calculus. At some point, you know your divisions, you know your multiplications, and then you're giving a calculator to do it faster because you know the basics. And so I think there's a good question to raise on whether trainees and young doctors should already be using this tool. Are they missing something? At what point should it be allowed for them to take on?
There is also something creepy, despite the very innocent name of Heidi, that Heidi is always listening. Heidi is recording everything that you say and sending it to Australia. And the topic of the conversation, your very personal medical details. I mean, if there is a potential, I mean, it sounds like a good principle to save time for doctors as long as Heidi doesn't get hacked. Yeah,
no, we don't want Heidi to get hacked. And I think in the discussion about innovation, we obviously want to help doctors. We want to decrease their workload. We want to get more patients in clinics in general to improve overall access and care. But we should also just be aware that maybe the presence of a so to say, listening technical tool changes kind of the dynamics of a consultation altogether.
Yeah.
Like, will I be comfortable to share some private information about my medical history that maybe is a bit uncomfortable for me? It's already tricky for me to share that with a strange person. And so, yeah, that's just good to be aware. And I think that's where the very important question of consent comes in.
Yeah.
I think doctors should keep up to asking their patients. In a recent study in New Zealand, we have had only 60% of doctors asking their patients for consent for using Heidi. So that leaves 40% of patients who don't necessarily know that Heidi is in place. So, and I'm not quite sure what I think about that, but we don't know whether in the future, when Heidi or other AI tools will get implemented on the big scale, if the question of consent will actually still be relevant, or if it will just be ditched.
And honestly, as this becomes more and more common, anytime you're stuck on a call center, and sometimes that is hours of my life, they say, hey, this call may be recorded for training purposes. I'm not sure if I've ever been used for training on how to deal with difficult customers. But this almost becomes ubiquitous, that actually the conversations that we have with service providers are recorded to make sure that they've got an accurate record. And also, I suppose, if people have different recollections of what was said and what was asked for and what was promised, then we've got, I suppose, a record of what was said in case there's a dispute in these areas. Yeah,
no, that's true. And that's another area where Heidi could potentially be a great opportunity to kind of clarify tricky situations in the clinical setting. It could just help to have the doctor have a better recollection of the consultation and a better accuracy of what was actually said.
Yep.
Although there are hallucinations, so the tool does make mistakes.
Mm-hmm.
They're minor, about 1 to 3% is kind of the error or the failure rate. So
can I just stop you there? You're
lot.
saying that Heidi has hallucinations. This is very different than the Heidi that I read as a child.
Maybe it's Heidi on drugs.
Heidi on drugs. This is that's concerning in a whole different way. But by hallucinations, you mean that the AI sometimes misinterprets what is said, or perhaps if somebody has a particularly strong accent, or there's extra noise in the room. These are the hallucinations we're talking about. It's
exactly.
not,
sorry,
okay.
I should have clarified that. I was using technical jargon there.
Heidi on psychoactive substances. This is not what we need in our doctors, right?
This is not what we need our doctors to use. No, even though that could give them more energy.
Well,
but
yeah, exactly.
Not on the long term.
Exactly.
Anyway, there are technical errors to the tool, and the provider has been very transparent about that, which is good. And that's why he suggests for doctors to just right after the consultation, once the patient walks out, to check the note, just make sure it's correct, just make sure there's nothing missing, there's nothing in there that's just that the patient actually didn't quite say. And I think for doctors it will be, we just need to make sure, obviously they will still need to do some critical thinking, and they still need to be alert and present during the consultation. They can't kind of offload that and be saying, oh, like my little Heidi will just summarize all of that for me. I can just sit in there and listen. But obviously they need to check the note. They need to make sure it's correct. And they need to make ultimately a good decision, which requires critical thinking about what was said.
So essentially, privacy, accuracy, consent. If we can tick all three of these boxes, Heidi may be a good thing. But if we can't have assurance on all of these three areas, then perhaps we need to explore this further. Would that be a fair summary?
I think that's a great summary. And I think we should just check this out, be open to the outcomes, observe, and not kind of jump on the train right immediately and buy Heidi for all of New Zealand's clinics.
Yep.
I'm not sure that would be the appropriate kind of measure to go about this, but it's a good trial phase. We'll just observe, and we can hopefully in the future have our data stored here in New Zealand and not overseas. And if we keep on that path, and just if we're open to any outcomes and also to the good ones, I think we're on a good path.
Privacy, accuracy, consent. I think those are good things in a lot of situations, including this one. Debora, thank you so much for the work that you do at Maxim. I appreciate this conversation. Merry Christmas to you and yours. Thanks for joining us.
Yeah, thank you, Andrew. Merry Christmas.